you, James, so much for that opening remark. And now that we've grounded ourselves in the why we're here, let's talk about how. Before we begin, let me introduce our first two speakers, deeply rooted. Both of them are deeply rooted in Bermuda's mental health community, and they're both board members of the foundation. First, we have Ms. Annie Richardson, who is a senior HR professional, workplace mental health consultant, and director on the board of the Bermuda Mental Health Foundation. She's committed to normalizing mental health conversations and equipping organizations to support their people. Vaughn Mosher is the managing director of Benedict's, the famous Benedict's and Associates Ltd. He holds a master's degree from Boston College and Johns Hopkins University, and previously founded Bermuda's Alcoholism Services in 1978. So with decades of service across public health and human rights, Vaughn continues to support individuals and organizations through coaching, counseling, and consultation. Let's welcome Annie and Vaughn to the stage.
Thank you, Jody. And nice to see you, Vaughn, and very, very happy to be here today. Jody, we want to share the presentation, the slides. Can you set that up? Yes, please. Perfect. Thank you. As introduced by Jody and James, we are the representative for the Mindful Employer Certification Program. We've got about 20 minutes to chat with you today about what is the Mindful Employer Certification Program and why we want to use it to build mindful workplaces. So we've been kind of introduced throughout the opening statements there, but just to reintroduce myself, I'm Annie Richardson. I am the program director for mental health initiatives at the Bermuda Mental Health Foundation. I'm also an HR professional, senior HR professional within an insurance company. I have about 25, I've just aged myself. I have about 25 years experience. Oh, hang on. Okay, there you go. I have about 25 plus years experience in HR in Bermuda, US, Canada, and the UK. And I will turn this over to Vaughn to introduce himself.
Thank you, Annie, and good morning to you. It's the first we've talked today. My background is basically a mental health professional, psychotherapist, working individually and in groups. I'm a consultant sometimes a lot of times to HR professionals in the client companies we work with, as well as corporate decision makers within our client companies. I'm an executive coach and also like to work with team training for both effectiveness and efficiency. So that's how I spend a lot of my time. Good morning, everybody.
Okay. Thank you, Vaughn. So as Jody and James talked about who we are as a foundation, we were founded in 1994. Our primary focus for the last 30 years has been in residential care management, facilities management in partnership with the BHP. Maybe 8 or 9 years ago, we kind of decided to add a little bit of a focus on mental health advocacy and education. And proudly, we introduced the Mindful Employer Certification Program about a month before the pandemic in January 2020. And so with the pandemic and everything, we introduced it. And over the course of the first couple of years, we had a really, really strong interest. There were a number of companies that were interested, but we had very limited capacity, I being the sole person administering the program while running a full-time job. The good news is that Vaughn joined us in 2024. Vaughn has a very, very strong interest in mental health and supporting employers with this program. So we were very, very happy to welcome him. And as a result, in January 2025, the board members decided that it was time for us to operationalize the Mindful Employer Certification Program and to seek to expand it across Bermuda. So we went off to the races, and literally just a couple of months ago, we were happy to welcome our two newest members, CG and KPMG, who certified in the summer, CG as a platinum member and KPMG as a gold member. Right. So we're going to start with a story. In my HR capacity, I've had millions of stories around workplace mental health, but let's give you an example. Let's call him Joe. So we have an employee named Joe. His manager contacts me and basically says, listen, I'm really, really struggling with Joe at the moment. He's not performing. He's not even showing up for meetings. He's not meeting his deliverables. He's always late. He's disengaged on calls. I don't recognize him anymore. I'm not sure what's going on. Can you talk to him? So check with Joe and find out that Joe, there's something that Joe doesn't want to tell anyone because he's very, very afraid. Joe actually is struggling with depression, and he's just changed his medication. And because of that, he's struggling. He's struggling to adapt to his new medication. But he's basically saying, listen, I'm not lazy. I'm not disengaged. I'm just struggling at the moment. So basically, Joe had an issue that we could not see. So manager would have otherwise, luckily came to us, would have otherwise potentially, gone down the performance management route. But instead, we had one conversation, asked like the right questions. And with that, I started working with the manager, with the doctor, with EAP, and we were able to adapt the role, to make some small adjustments, and to, make recommendations. And within weeks, Joe was, back at performing again. And that was 5 years ago. And Joe's still with us today. So bottom line is, this is all very, very simple. Like workplace mental health, it's literally about being willing to have those deeper conversations, being willing to make some adjustments, being willing to, keep good employees and recognize that everybody is wired, has their own challenges, and that if we make adjustments, we're able to facilitate. Hang on, I'm having a little bit of a. Okay. And so, and actually, when we think about it, what if Joe told us that he has cancer? How would we have dealt with that, right? So that's the part about ensuring that we're open to having these conversations. Now, when we think about Bermuda, one of the reasons why we looked into implementing the Mindful Employer Certification Program is that because prior to the pandemic, taboo is an understatement when we think about mental health and how that was discussed within the Bermuda landscape, right? People were very, very afraid to say something. They were afraid that, their information would not be kept confidential, that they would lose out on opportunities, that there'd be stigma, that their neighbors, that their, colleagues would struggle with them. Luckily, the pandemic, cracked the door open a little bit. I think it made people realize that, work and is just part of life, and therefore, your health and your mental health it all goes together, right? So during the pandemic, we started talking about stress, we started talking about burnout, we started talking about resilience. But in the end, the stigma still remains. It's much better. We're definitely more open to those conversations. But it's very, very important to recognize that we still have a lot of work to do. Now I'm going to turn it over to Vaughn, who's going to talk to us a little bit more about the data.
Thank you, Annie.
Yes.
I love this slide because not only is it alliteration, which I like, but these three factors, awareness, attitudes, and action, are all very, very different and yet interrelate beautifully, because not only is it awareness, but it's awareness of what? Accurate information about mental health, mental illness, emotional factors, attitudinal factors in terms of behavior and that. So we get the awareness increased, that impacts the attitudes from stigma and negativity toward mental illness, and changes it toward something that's approachable, something that's positive. And then those two things together, increased awareness and getting the attitudes from negative to positive, really allow for appropriate action. So many people have asked us, both Annie and myself, well, well, isn't that what EAPs do, or aren't those really just the same thing? And it's important to know there's significant distinction. This mindful employer initiative is within and all about what is happening within the workplace. It's an initiative that cultivates and really promotes awareness and attitude change. It's all about being purposeful and getting those attitudes right, because then that leads to intervention and hopefully an earlier, more meaningful intervention, and that moves then toward action, and that's where the EAP can pick up. So often a person refers self, and about 85% of the referrals are self referrals using the program as the tool that they have as a benefit, and about 15% are referred by managers, HR reps, or coworkers are often encouraging to send people. That would be considered a voluntary referral if it's a nudge by a coworker. But if it's a management referral, then that's because there's something about the performance that's not just right, doesn't match up with what expectations are, and so on. So that's where the EAP picks up and helps by, first of all, disaggregating what all of the issues are. People don't come with just one issue. It's a multitude of interrelated issues. They may be referred because of work behavior, and then we know that there's a financial problem. But really, the ultimate is, first things first, would be the drug use that's going on that impacts financially. So in most cases, more often than not, it's a multitude of factors that interrelate to make the person move closer toward overwhelm and further away from well-being. That's what the EAP does, is work with all of that. So when we really then, to go back to where it all begins, and that's within the Mindful Employers charge, that is changing attitudes. That's the beginning of impacting to change lives. Increased awareness naturally follows logically that will increase action toward doing something about it. And when we look back, draw back and look at the company as a whole, we know that personal and interpersonal well-being in the workplace then really does create a culture shift within that workplace. Work outcome suites. Some of you may have heard of this. It's been around since the 90s. It's exactly that. It's obviously in the workplace, and it looks at outcomes, desired outcomes, and that is getting to this action toward well-being. But it has a long history. It was started with Chestnut Global back in the 90s, which became very rapidly, a lot of EAPs back in the late 80s and 90s moved to internationalize and consolidate. So back then it was a private issue. It was looking at qualitative factors as well as some quantitative factors. So it's really honed itself over the years, and the research has gone for 25 years, particularly in the last 15, since 2010, it has moved far more to being a quantitative set of measures now rather than qualitative. You see that it's nearly by now 150,000 cases, and it's all over the world. It's global. And where I want to focus down onto these are the 5 major factors that are quantifiable, and you can read them there for yourself, but I'd like to just highlight a few things about each one of them. And that is, people say, well, what is reasonable absenteeism? And it's not always what the entitlement allows for absenteeism. Some companies are moving toward paid time off, and that's different than sick time. It's all of the time that's accrued. So when we see something that is below 3%, that is really good. Some companies strive for 2%, and good for them, and that's very workable. When it gets to be above 7%, it is problematic. And we're working over the years, over the many decades, we've actually worked with some individuals that have had more than 20% absenteeism. And it's sort of gone unnoticed. The people who could be watchful over it really weren't keeping track. They just knew that Johnny was out a lot, sometimes more often than in. So that's absenteeism. Presenteeism is what I like to call lights on but nobody home, and that is the body is there, whereas absenteeism, the body is not there. So the person is present, but observably, there's not a whole lot going on. The individual may be isolated and works in a bit of a silo. There are issues of just lack of productivity and so on. Workplace distress is when the issue is within the workplace itself. It may be from department to department or person to person. That goes on a lot and needs attention. Work engagement is really quite different than presenteeism, because when we're talking about work engagement, we're talking about the person being in the flow, that the cognitive elements, the emotional, and how they behave are all synchronized, and the way they think and feel and behave are congruent. And that, by the way, is a handy definition of high-level mental health, is when we think, feel, and behave consistent, those three things, then we're doing pretty well. We're in synchronicity. With work engagement that is low, the behavior is erratic, deadlines are missed, work is incomplete or not realized fully. It's generally subpar to one's capability and may have changed over time. That's observable. The last one is what historically EAPs used to look at primarily, were all of the life issues that for work-life balance, the life part of work-life balance that people bring from their personal lives. When something goes wrong there, a whole host of issues, legal, financial, interpersonal, parenting, all kinds of things that fall under this very broad umbrella called life satisfaction. So those are the five, and they're interrelated. Guess what? When you see the graphs over on the right-hand side, the main observable is, of course, presenteeism, because the person is actually in the workplace. So that's the most obvious, headed for 60% of prior to intervention. These are the observables. And as you can imagine, presenteeism has interaction with the other four as well. It often is a life satisfaction factor that's going on, but it doesn't show up in the workplace that way. It shows up as presenteeism. So be mindful of that, employers and colleagues, work colleagues, that if you sense presenteeism amongst your team or your work group, that's often reflective of one of the other four issues going on. Yeah, that's a whole lot. We could spend a whole afternoon talking about just the research with this, what Workplace Suite has done. There are tremendous reports and by country and all kinds of demographic breakdown. It's nothing short of masterful for what the global work world is really demonstrating now, and it's being taken on as by the EAP Association. That's worldwide. It's accepted as the major undertaking for what now is quantifiably the way to go and what to look at. Okay, on to the next slide, and that is, so what about all this for the finance people amongst us? Not just finance, but we like to rag on the controllers, right? ROI is not just a financial issue or a dollar issue that your finance department needs to be concerned about, but rather in all kinds of aspects of return on investment, of having the mindful employer initiative in hand with the EAP. Return on investment has always had a qualitative component. It can be monetized. Things like healthcare costs and crisis control and a whole bunch of things with turnover and recruiting, immigration costs, a bunch of things like that are all there if somebody really wants to get into it and measure more deeply. But those are the more quantifiable factors. What I like is when you drop down to this next set is the LPT, the loss of productivity, is a combination of absenteeism and presenteeism, just those two things. And it is totally quantifiable because there's a neat combination as to how that's fairly easily put together for the employees' behavior-related activities. And there's the math below. If you figure a 40-hour week, or for many 37 and a half, if you're in a bureaucracy usually, but whatever the anticipated work hours, if it's 40, that's 172 a month. And then everyone has naturally a different rate of pay. Before intervention, this is just a quick example of a person who's working at 75% capacity. Intervention occurs, gets measured pre and post, 90 days, 180 days afterwards, and you see that that person who was working at a perhaps 55% capacity is now up to 85, 90, 95% capacity. That's a huge difference compared to pre and post. And with dollars added to it for what the rate of pay is, people who, not just accountants, but others can calculate thousands of dollars saved. Internationally, looking at companies large and small all over the world, it looks as if for the intervention that occurs, it's about $1 for every $1 spent, it's about $5.50 returned to the employer. So that's pretty neat. That's it for that slide. Annie, back to you.
Can you hear me? Okay, good. You can hear me, Vaughn?
Yeah.
All right, so let's get into the meat of things. Let's talk about what is the Mindful Employer Certification Program. I want to start by saying, imagine, I'm having camera problems. It keeps applying, hang on a second. Okay. So I'm going to start by saying, imagine if we asked all the right questions. Imagine if we made accommodations. Imagine if employees felt that they can safely discuss workplace, stress, workloads, their personal pressures, like caring for their aging parents, like being a new mother, without fear. That's what the Mindful Employer Certification Program is. It's not a trophy. It's not a badge. It's not a frame. It's not a trophy. It's more of a framework. Really, the framework looks at 5 main areas. So it's around policy, it's around training, it's around support, it's around managing culture, and it's also having champions embedded into the organization. So what you see here on the screen is there are 4 types of levels, right? So you have bronze, silver, or gold, and platinum. Basically, what we've tried to do is we've tried to make the process as the least onerous possible. So basically, whether you meet 6 of those standards, 9 of those standards, 13 of those standards, or 14 of those standards, you can attain one of those levels. So whether you're a small organization and you don't have a whole lot of big policies and things like that, but you do have 5, like if we look at under the bronze there, you do have a minimum of 5 policies that support mental health. Well, you're on your way to becoming a bronze certified organization. Larger organization may have a whole lot more structure and may want to go after the higher level certification. But certainly we are appealing to all types of employers, small, large, big companies, government, doesn't matter. In the end, what we try to do is, irrespective of how many standards you meet, here is irrespective of what level you're looking to achieve, there is one overarching requirement, and that's training. 5% of your employees need to have completed the mental health first aid course, which is a course that is offered by BHB. It's a 2-day course. So in the same way that You have to do, first aid courses for your organization. Mental health first aid, we want 5% of your organization to be aware of what are some of the key points around mental health from a first aid perspective. There's also manager training, so we want to ensure that managers are trained on understanding mental health in the workplace and how to support your employees. And then there's also all staff lunch and learns, and for all staff to understand, also kind of like understand what the terms are, and also getting more of an opportunity to normalize the conversation around mental health. And then if you're ambitious and you meet all of the 13 standards that are there, and you want to have your managers complete the program called Mindful Leader Program, which is a program that is in a partnership with CG, and it's a program that is administered by a gentleman by the name of Michael Apollo with the Mindful Society in Canada. This is a 6-week program, and it's a mindful leader program. It's basically a leadership program that focuses on mindfulness, on stress management, and communications. It's a wonderful program. If as a larger organization, you choose to follow this to have 10% of your managers complete this program, you can qualify for platinum level. So there's a little bit for everybody, right? So that was the whole goal of this program, is that we wanted to make sure that we were appealing to all types of organization, whether you're a small mom and pop shop or you're a large organization. Next slide. So I recognize that we're going to be wrapping up soon. Basically, what we want to think about is we want to give you a challenge. So your challenge, similar to what I said earlier when I introduced Joe to you, what we want you to take away today is, whether you're a manager, you're a colleague, whatever it is, be more intentional. Embrace conversation. Sometimes it's not just saying, how are you? Sometimes it's, saying, like, what can I help you with today? What can I help you with this week? And it's let's be more intentional, because you may end up opening more conversations by doing that. Still have camera issues there. The other thing is challenge your own bias. Just like I said before, what if it was cancer? What if it was somebody's broken leg? How would we treat that, right? Like, we have to think about the fact that 1 in 4 in Bermuda or worldwide, 1 in 4 suffers from any sort of mental health issues. So, like, any room that you walk in, there's probably someone who's on medication or who's suffering from something, right? So we have to challenge our own bias and recognize that mental health is health. And then the third challenge is, obviously, we'd like for you to contact us and to schedule an intro call, whether you're a manager currently interested in talking to your HR department or to your leadership team to get them to start looking into embracing the program, or whether you are a decision maker who is interested in this. We're here for you, and we want to answer any questions you may have. So we'll provide at the end of the presentation, there's some contact information. We'd love to hear from you, and we'll be sure to set up an intro call with you. So let's wrap this up. So if I go back to Joe, right? Joe is still here. He's been with us for many years. We're 5 years on, he's still here. 5 years ago, if he didn't speak up, he would have either walked out the door, quit his job perhaps. He would have probably maybe been managed out of the company through the performance management process, right? But because he thought he couldn't say anything, the fact that we opened the conversation, he was able to change the path for his own career. So workplace mental health is about making sure that no one feels that they have to stay silent. So imagine if every workplace in Bermuda felt safe enough for these conversations. That's the vision. And that's MEC. That's who we are. And we really genuinely believe that we can build it together. So, and this is the last slide here. If you want to take a picture of this, this is how you contact us. I'm Annie Richardson. You can call me, you can email me, you can send a note to info@bmhf.bm. Vaughn, his information is there. But absolutely, we are available and ready to come and talk to you. So thank you very much for your time. And we're looking forward to encountering you down at some point. So thank you very much. And thank you, Vaughn, for all of your hard work. Okay, take care.
For Workplace Outcome Suite, contact me and I'll be glad to send you a copy.
Yes. So I don't know, Jody?
Hi there, you guys. Thank you so much, Vaughn and Annie. That was amazing. And that program, I remember when it started and all the work that went into it. And you have really just taken it up and made